Hello everyone and welcome to the last week of class. You guys made it. We are continuing to work through some of the abnormal psych material. Last week we covered psychological illnesses and disorders, and this week we'll be taking a look at therapies for those. So again, I think I mentioned last week in the podcast that these are two chapters that really help if you sort of read them flipping back and forth. So the mode that I usually tell students is when you read in chapter 12 about a disorder, say depression, you then would maybe want to go over to chapter 13 and go, okay, what does chapter 13 say about treatment and therapy for depression? And I feel like that's a better way to understand the material. Now that you've already read through and been tested on chapter 12 material, you have a good sense of what those disorders are, but it might help to just keep flipping back to it as you're kind of going through chapter 13 and figuring out the therapies. And what you're going to notice too is a lot of the therapies are used for many different kinds of disorders. So it's not necessarily just one type of therapy for one disorder. They overlap very much so. And as you read in chapter 12, a lot of people have comorbid psychological conditions. So a person might be suffering from depression and anxiety, or, a personality disorder and a social phobia or something like that. So they often go hand in hand, and that's why the fact that the therapies overlap so much is really actually good, because you can kind of target multiple different disorders with one type of therapy. So let's take a look here at what you guys have coming up. This is technically week 15, which is the last week of class. However, your final exam is the following week, Monday. So technically Monday is week 16. So May 6th is week 16 is our finals week. I think on-campus classes end Tuesday. So you'll pretty much have week 15 to work through all the material, and then the following Monday on the 6th is when is the due date for the final exam. The final exam is 45 minutes, so make sure you leave yourself enough time. If you're starting the exam after 11:15, you're not going to have enough time. So the computer will kick you out. Once that 45-minute level has been hit, it'll stop you and it'll kick you out of the test. So unless you plan on doing the test in less than 45 minutes, I would be careful at what time you start with the final. So in terms of what you're going to be looking at with Chapter 13, Psychological Therapies, we're going to be looking at kind of the history of how psychological disorders have been treated in America, and sort of they now encamp into two broad categories of therapy that we use today. But we will take a look at typical types of therapy, past and present, like Freud's psychoanalysis. You might remember this from the personality chapter, his psychoanalytic theory about personality, and the more current psychodynamic approaches that we use more so today, and what those have to say about the origins of psychological illness. We'll be taking a look at humanistic therapies. So if you remember, Maslow and Rogers kind of are in that camp, and they propose the person-centered therapy and Gestalt therapy. So you'll take a look at the elements of each of those and the goals of a client who is in that kind of treatment. What would be the goal of the therapy sessions or the outcome of those sessions. We'll take a look at how behavioral conditioning is used, so the classical and operant conditioning, and then as well cognitive therapies. We'll take a look also at when group therapy can be done. A lot of times group therapy is good because clients don't necessarily need to meet one-on-one with a therapist, and they might actually benefit from hearing from others who are experiencing similar symptoms or dysfunction in their life due to the illness. And so group therapy can be a really good setting for certain individuals. So we'll talk sort of about that and where it's most effective. And then we'll look at psychotherapy, which is usually one-on-one, even into cyber therapy. So there's a lot of therapy being done online now rather than face-to-face. We'll look at the effectiveness of these different types of therapies, and then take a look at the drug therapy, which is a whole nother class. And oftentimes the drug therapy is used in tandem with psychotherapy. So it is very common for a person with a mental illness to be receiving some sort of drug regimen, as well as going to maybe weekly or bi-weekly or even more than once a week meetings with their psychotherapist. And that has actually been shown to be the most effective treatment for many of the psychological disorders. We do still use electroconvulsive therapy and psychosurgery today, and some other biomedical techniques. However, they are more rare and more for very serious forms of some of the mental illnesses that we talked about in chapter 12. So take a look at why and when would these be used, what would be the results of these kinds of treatments and therapies, and who can they benefit the most. And then the last thing we'll be exploring is virtual reality, which actually has been really great in treating a lot of anxiety disorders, PTSD in particular, putting people in settings much like those that they're afraid of, and then walking them through it, kind of through the use of some other technological treatments like biofeedback. You can measure a person's physiology as they're experiencing fear or they're experiencing panic related to the exposure of the thing with which is causing the anxiety. And then the therapist can be right there to walk them through it cognitively and behaviorally to help them hopefully overcome it. So that's the chapter, sort of at a glance there. We have the lecture slides. And again, please take these. The best way to do this is to print these out and have them next to you as you're reading through the chapter. So that way you're kind of seeing how things mesh up. The videos that we're watching this week are in episode 17 again. If you remember from last week, the episode's kind of split into two. So this week you're going to be watching all the videos that have to do with psychological therapies, and it's pretty clear which ones are there for that. There are no additional videos this week, so just the ones in My Psych Lab are the ones that you'll be watching. Your discussion this week has to do with systematic desensitization and its use as a therapy, specifically in treating phobias. Okay, so if you'll recall, we spent a little bit of time earlier in the semester when we were covering Chapter 4, Learning, and we talked about the acquisition of phobias, fear responses, that much of it is learned through classical conditioning and operant conditioning. If you remember little baby Albert and the white rat, how he was conditioned to fear the white rat, and really developed a phobia to anything generalized to a white rat. So anything that was white and fluffy, and this phobia kind of stuck with him, which is why the experiment was highly unethical. But so we're going to kind of be coming back to that because, you know, if classical and operant conditioning can be used to create a phobia, it can also be used to help treat a phobia. And so systematic desensitization is one of those types of therapies that does just that. So you're going to be taking a look at it. How effective is it? How are the acquisitions of phobias related to some of those earlier concepts that we talked about? So here you're going to want to be integrating in your Cicerelli White textbook, and you're going to want to go back to Chapter 4 and kind of tie in some of that to your discussion here. Okay, so I should see every single student citing their textbook for support here. Okay, And then based on these principles of learning, what other types of therapy might be useful to treat phobias? What would you think? Okay, so that's your discussion. This is your last discussion for the entire semester. Likewise, you'll have your final quiz. We'll close on Friday. That is on chapter 13. And then your final exam will be covering chapters 7, which was the cognition, thinking, intelligence, and language, as well as chapters 12 and 13, so all the psychological illness and therapies. And again, your final exam closes next Monday. One last extra credit opportunity, and this one is sort of a fun one. You can select a movie. I've listed some here. There's a link here to a website that has many more citations of movies, but pick a movie that deals with a psychological illness. Okay, there's so many good ones. And you're going to watch the movie, and then you're just going to write up a 1 to 2 page paper describing what the disorder was in the movie. How did the person or persons show symptoms of the disorder? How did it affect their life? In what ways was their life disrupted by their disorder? And what types of treatment, if at all, some movies don't always show this, but if it does, what types of treatment were used for the person, and how did they respond? Okay, what kind of resolution did they get? Like, is this a person who learned to cope with their disorder that got better? What did that look like? And then go out on a limb and indicate what you think the best line of treatment would have been for a person with that said disorder. And here you can use your Hawk book, you can use your textbook for support in making that conclusion of what you think. Okay, so you're going to click into the assignment here, and you're going to actually write your assignment into the assignment box. You're not going to attach it as an email or anything like that, but it is worth 5 extra credit points, and obviously it is the last extra credit assignment of the semester. So with that, we are all done. I just want to thank everyone for being a great class. I received so many good emails throughout the semester. Students really just zoned in on learning. This was a great online class, and I just enjoyed interacting with a lot of you online, and some of you actually came in to office hours, so I got to see you in person. So that was actually really cool. So I just want to thank you guys for being a great class, and please let me know if you have any questions in this last week. Okay, good luck everyone. Thank you.